Good morning, doctor. My name is Julie from PMR Pharma, a Filipino-owned national company that specializes in anesthesia, anti-infectives, and critical care. I'm here to introduce to you the gram-negative specialist and the partner of choice of empirical combination, the gram-negative infect. The gram-negative infection. Our central generic name is Astrayona. Each vial contains 1 gram powder and can be given intramuscularly or intravenously. There are certain types of bacteria around us, but we're not aware but are actually dangerous and harmful. This can cause serious illnesses or infection that are extremely hard to treat. These are the gram-negative bacteria. This can cause many types of bacteria that are spread to human body in different ways. Several species like Escherichia coli are the common cause of foodborne disease. Vibrio cholerae is responsible for waterborne pathogen. Gram-negative bacteria can also cause respiratory infection including pneumonia, sexually transmitted disease including gonorrhea. Yersinia pestis is a gram-negative bacteria that are responsible for plague. It also transmitted through people through through the bite of insect or handling infected animal. But like an armored man, Astrayona Santron displays potent wide spectrum against gram-negative aerobes, including Pseudomonas aeruginosa pathogens that are resistant to other antibiotics. It is a bactericidal agent that acts an inhibition in cell wall synthesis. It has an activity against Enterobacter and Pseudomonas aeruginosa because of its unique feature compared to other B-lactam and stable by hydrolysis by amber B-lactamase. And to add on that, Santron Astrayonam has an active ingredient called Astrayonam, which is a monobactam that is originally isolated to Chromobacterium bacillation, and it is a synthetically bactericidal antibiotic. This monobactam is a unique monocycline beta-lactam nucleus that are structurally different to other beta-lactam, including cepenicillin, cephalosporin, cepamycin. And due to similar reasons, Santron Astrayonam lacks cross-reactivity to other beta-lactam. And also, it is a good better alternative to other antibiotic like allergy penicillin. And yeah. And also, to reduce the drug resistance of a product, it should be used for patient with susceptible bacteria. So to elaborate on that, these are the susceptible bacteria. Complicated urinary tract infection, lower urinary tract infection, including pneumonia, bronchitis, and skin and skin infection, intra-abdominal infection, and lastly, the gynecologic infection, including endometritis and pelvic cellulitis. And based to Townsend Absola of Medical Sciences, Santron Astrayonam is the right partner for anti-pseudomonial combination therapy. It ensures the synergistic and action to prevent the risk of development of resistance. One of the best combination therapies are the Santron plus Cepepine. These two products found that it is effective for patients with nosocomial infection in ICU that due to Pseudomonas aeruginosa multi-drug resistant. And according to the study of university in France, that Santron plus Cepepime, there is if there's overexpressing in AMPC in Pseudomonas aeruginosa, it can be treated by Cepepine 2 gram plus Aztreonam 2 gram every 8 hours, and the treatment took 14 days, and the results were 69% clinical cure rate. And also, according to the study of Nakamura et al., in the combination of Aztreonam Santron plus amikacin aminoglycosides, it's significantly demonstrated against multi-drug resistant organism, Pseudomonas aeruginosa. He uses demonstrated and evaluated the 1,050 patients in Tokyo Medical University Hospital to evaluate the infection in combination of Aztreonam plus monobactam and other antibiotics. And the result is the amikacin plus abergacin demonstrated the for dose-dependent inmic or minimum inhibitory contribution against multi-drug resistant plus to isolate the Pseudomonas aeruginosa. And also, the empirical combination of Aztreonam Santron plus vancomycin provides a high clinical cure rate for patients with most causative gram-negative and gram-positive in acute bactericidal skin-and-skin infection. And also, Aztreonam Santron, the advantage of Aztreonam Santron is super alternative to aminoglycoside, because aminoglycoside can cause nephrotoxicity and ototoxicity. But on the other hand, Aztreonam Santron can treat gram-negative infection and cannot use the dose serum concentration. Aztreonam Santron can be given intramuscularly or intravenously. The adult dosage is 1 to 2 gram every 6 to 8 hours, and recommended dosage per day is 8 gram per day. While in the PEDJA patient, 30 milligram per kilogram per day, and every 6 to 8 hours, and the recommendation dose is 120 milligram per kilogram per day. Lastly, Aztreonam Santron is a FDA and PNDF and evaluated by CEDRES with a score of 100.42 and SRS Pharmaceutical, a GMP certified, and the retail price of 1,400 and widely used in a major hospital. Once again, I'm Julie from PMR Pharma. Thank you Dr. Bernice.
Okay.
Much better.
Good, good, good.